I'm the Assistant Dean and Program Director of the Mental Health Counseling and Graduate Program in Masters of Psychology at Adelphi University. The alcohol and substance abuse specialty in psychology is quite different. It's a much broader perspective in the field of psychology and has been around for many, many years. And the specialization in this area requires kind of a very broad systemic perspective that involves medicine, it involves legal, it involves forensic, it also involves some of the other more kind of social sciences like sociology, social work as a practice. And so many of the subspecialties in psychology doesn't pull for that many other disciplines to be involved in the treatment of a patient as this specialty does. I would imagine that a lot of people got involved in this area as I have, which is almost out of necessity. So many of our patients who come in with depression or anxiety or other psychological conditions may also substance abuse, but don't report it. And so sometimes just by chance, you find out that a patient is actually abusing marijuana, or they might be abusing prescription painkillers, but they never reported it at intake. And increasingly, I found a lot of patients coming to me and other colleagues with very similar situations where they hadn't reported substance use in their intake, but clearly was something that was impeding the progress of the therapy and later came out. As I started to read up in this area, I started to realize that this was much more common than it was just a happenstance. And I realized that this could be a potential area of interest as well as a niche. And so I started to read and study and get involved in symposiums and colloquiums where possible, and began to kind of self-teach myself some of the area of addiction. You know, an average day in the life of a psychologist is always quite interesting, but that of a substance abuse specialist is even more so. Typically, let's say in an outpatient setting, an alcohol or substance abuse specialist will likely do an assessment first thing in the morning. They'll probably have 2 or 3 individual patients that they would see, probably followed by a meeting of some sort. And then they probably do a couple of groups, because in this area, group practice is incredibly important. A lot of the field believes that peer influence and peer pressure, so to speak, is very helpful in getting people to decide to make change. Then that would probably be followed up with either some consultation on the phone, either with an MD as a follow-up with a patient that you might have seen that day. You may conversate with an EAP specialist, an employment assistance professional. You may interface with a legal team if one of your clients is involved in some sort of legal proceedings. And then you call it a day. It's a pretty full day. Someone that is non-judgmental. Alcohol and substance abuse still carries with it a strong social stigma. I think one going into this area has to be aware of their own involvement with drinking or using anything medicinally or recreationally. Or if they have a strong feeling about it in one way or another, that it doesn't come with a set of judgments or biases that would predispose them to much more challenge with working with these patients. Patient, because there's a huge amount of relapse in this area. Years ago, many therapists veered away from working in substance abuse because of, well, one reason is because of the high relapse rate. It feels like you haven't done well enough. It feels like you failed in many ways. And that leads to a lot of burnout, a lot of frustration on the therapists themselves. And so a lot of people kind of left some of this work years ago. And so I think having tolerance and having patience with this work, knowing that there is a high rate of relapse, but that it doesn't necessarily reflect whether the therapist was good or not, that it's the nature of the condition. And I also think that the therapist must be flexible. They have to be a good listener, and they need to be empathic. I would have loved someone to tell me how wonderful the profession is. It really has a kind of gratification built into it that I liken to working with children. You really do get a chance to see a person turn their life around once they finally get it. And the change can be very dramatic. I would have also liked them to have told me to get into it earlier, to start training earlier, so I didn't spend so much time doing other things until I finally found this thing. In that there are many ways to get the training, and it doesn't necessarily have to be through the university, but that would be a great way to get it. You can also get it by reading. You can get it by going to symposiums and conferences. You can get it by doing webinars online. You can do it simply by going to an AA meeting and asking questions. And so most of my learning came over time, whereas I think if I would have gotten that education early, it would have saved me a few years. You know, psychology has been involved in substance abuse going back years, probably about 100 years or so. Practitioners in the 20s and 30s working in this area who decided that maybe this wasn't the best use of psychology, or maybe there were other more interesting or more diverse things that psychology was interested in at the time, left a real gap in the training of the psychologists in the next generation for substance abuse. And up until now, there's still a fairly large gap in the training of psychologists to go into the field of addiction, particularly alcohol and substance abuse. And so probably over the last, I'd say 15 years, there have been kind of a resurgence of interest in this area of developing more courses at the doctoral level, certainly at the master's level, that gets psychology back involved and kind of reinvigorated, if you will, in this particular area. You know, a lot's changing with some of the healthcare reform initiatives, but I think alcohol and substance abuse services will remain a demand. The population doesn't seem to be declining in its use and its popularity of some of the substances. So I think in general, the field will only grow. The demand for specialists in this area is going to increase significantly. You know, the rewards, again, is similar to the rewards seen as patients move from use to non-use. One of the things I try to do when I do workshops and conferences is reach out to the people who are reaching out to other people and try to offer them as much as I know about making determinations of substance use, how best to be useful to someone when they come in and ask for help. And when it involves other people, we have an interesting statistic that for as many people that they are abusing substances, their substance abuse affects about 4 to 6 people. Well, if that's true, that's a lot of people. And so not just the professionals, but a lot of people need a lot of educating on the effects of substance abuse and what to do when you see it. So what I try to do in the academic world is to bring that information to bear on as many courses as I teach. I think one of the things that they should ask themselves is, how much am I going to be affected working with someone with a substance abuse disorder? The question asks them, at least implicitly it asks them, have they had any involvement themselves in substances, or anyone in their family or friends that was involved with substances that may negatively affect their work with a substance abusing patient? I would add only that out of the varied responsibilities that I have as a clinical psychologist, it's a great profession in a sense because you can do so many different things. When I put them all together, alcohol and substance abuse becomes kind of the umbrella for all the other things that I do. And so when people ask, I say, if you specialize in this area, you can almost turn it into its own field and then have smaller specialties within it. Not so easy to do when you into some of the other areas of psychology. But in this area, because it's so broad, you can do various activities that make alcohol and substance abuse specialization a really true and fun specialization that one can have a long career in.